Hello, viewers. You're welcome to today's series with Dr. Sam of the Health Sentinel. And our topic today is adolescent mental health. Adolescents are the people between the ages of 10 to 19, and it's a unique and formative time in the development of these people. Multiple physical, emotional, social changes occur in this period, including exposure to poverty, abuse, violence, and can make adolescents vulnerable to mental health problems. Promoting psychological well-being and protecting the adolescent from adverse experiences and risk factors that may impact their potential to thrive are critical. And then adolescence is a crucial period for development and maintaining social and emotional habits. Importance for mental well-being, and this include adopting family sleep pattern, taking regular exercises, developing and coping with problem solving and interpersonal skills, learning to manage emotions, and then supporting families at school and other things. So the multiple factors determine mental health outcomes of adolescents, and the more risk factors adolescents are exposed to, the greater potential impacts on the mental health of the family. Factors that can contribute to stress during adolescence include desire for greater autonomy, pressure to conform with peers, exploration of sexual identity, increased access to and the use of technology, media influence, gender norm can exacerbate the disparity between an adolescent lived reality and their perception and then the aspiration for the future. Okay, so some adolescents are at greater risk for mental health condition due to their living condition, stigma, discrimination, and or exclusion of lack of access to quality support and services. These include adolescents living with or living in humanitarian or fragile setting, adolescents with chronic illness like autism spectrum disease, intellectual disability, or other neurological condition. Others could be pregnancy. There is pregnancy in adolescents, adolescent parents, and those in early or forced marriages, orphans, and adolescents from minority ethnic or sexual background and other discriminated group. So adolescent mental health conditions are in turn particularly vulnerable to social exclusion, discrimination, stigma, educational difficulties, risk-taking behaviors, physical ill health, and human rights violation. So now we're talking about the emotional disorders now. Emotional disorders commonly emerge during adolescence, in addition to depression or anxiety. Adolescents with emotional disorders can also experience excessive irritability, frustration, or anger. Symptoms can overlap across more than one emotional disorder with rapid, unexpected changes in mood, emotional outbursts. Younger adolescents may rapid and unexpected changes in mood and the outburst, like I said earlier. So, global depression is fourth leading cause of illness and disabilities among adolescents aged between 15 to 19 years. Anxiety is the ninth leading cause of adolescent deaths between the ages of 15 to 19. and sixth for those between the ages of 10 to 14. Emotional disorders can profoundly affect areas of life like schoolwork, school attendance, social withdrawal, loneliness, and depression, and also suicidal thoughts and attempts as well. So, childhood behavioral disorders are second leading cause of diseases burden in in children, in young adults between the ages of 10 to 14, and then the 11th leading cause of changes among the older adolescents between the ages of 15 to 19. So that's the second one. So eating disorders. Eating disorders commonly emerge during adolescence and young adulthood. Eating disorders affect females more commonly than males. Conditions such as anorexia nervosa, bulimia nervosa, binge eating disorders are characterized by harmful eating disorders, such as restricting calories or binge eating. And eating disorders are detrimental to health and often coexist with depression, anxiety, and substance abuse. So, psychosis also could emerge. Conditions that include symptoms of psychosis most commonly emerge in late adolescence or early adulthood. Symptoms include hallucinations and delusions, and these experiences can impair adolescents' ability to participate in daily life and education, and often lead to stigma of human rights violation. Okay, and then suicide and self-harm is also part. An estimated 62,000 adolescents died in 2016 as a result of self-harm. Suicide is the third leading cause of deaths in older adolescents between the ages of 15 to 19, and nearly 90% of world's adolescents live in low middle income countries, and more than 90% of adolescent suicides are among the adolescents living in those countries. So, talking about risk-taking behaviors, many adolescents rather take risk behaviors for health, such as substance use. Sexual risk-taking starts during this period, and then the risk of abusing tobaccos, cannabis, and other forms of drugs are abused. So now, talking about promotion and prevention of these adolescents, these adolescent issues, and how to actually prevent it. Mental health promotion prevents interventions aimed to strengthening an individual's capacity to regulate emotion, enhance alternatives to risk-taking behaviors, build resilience for difficult situations, adversities, and promote supportive social environment and social networks. So these programs require multi-level approach with varied delivery platform, for example, digital media, health and social care settings, schools or community varied strategies to reach adolescents, particularly the most vulnerable. Early detection and treatment is key. It is crucial to identify and address the needs of adolescents with defined mental health condition, avoiding institutionalization and over medicalization priority, and prioritizing non-pharmacological approaches because of the risk of going into overdose of drugs, and also respecting the child's rights in line with the United Nations Convention on the Rights of Child and Human Rights instruments are key for adolescents. WHO Mental Gap Action Program provides evidence-based guidelines for non-specific and non-specialized people to enable them live a better life and identify prior mental health condition in lower self-condition. With this, I hope I've been able to throw light on adolescent mental health and the risk associated with mental health of adolescents, and how to adequately identify this risk and prevent it before it causes harm in adolescents. Thank you very much for listening. God bless you. Dr. Sam again is my name, and I'm from the Health Sentinel. You're welcome to like our page. You're welcome to share this video to people who might be in need and who the video might be helpful to. Thank you very much.